So now we'll hear from Thomas.
Getting oh wait, they're gonna restuck. Somebody bringing that up, or there we go. Well, it's a real pleasure to be here with all of you. Yesterday was fantastic. This is my second meeting with the forum. I think I attended one of the very first meetings because my former agency, the Office of Justice Programs, I believe was instrumental in setting this up. The National Institute of Justice. So it's very good to be back. I come to this work first through a career in government. I began as a criminal justice analyst. I then went to law school, became a prosecutor, prosecuting basic street crime in New York City. Then I did some white-collar criminal defense, again in New York, hated that, and then decided to join up on a campaign with this senator who had a very funny name, named Barack Obama. And from there, ended up becoming an appointee at the Department of Justice, then became the head of public safety under Governor Cuomo for the state of New York, supervising state police, the correction system, all criminal justice, homeland security, emergency management agencies, 40,000 people, $3.5 billion under management. And now I am at the Kennedy School of Government, writing, reflecting, and also really pursuing what's been a particular passion of mine, although I am sort of a criminal justice generalist, a passion for this issue of violence reduction, particularly youth violence reduction. And so I'm pleased to be here representing No Violence, and so let's begin. So we're going to talk about knowing and measuring community violence. I'm going to introduce to you the No Violence effort and then talk more about my specific area of expertise, community violence. So I like to begin at the end. This sort of keeps me honest to make sure that I've hit all my points. But the first thing you should know is that the No Violence effort is a learning-based advocacy initiative that seeks to prevent violence against children in the home, at school, and in the community. Then turning to community violence specifically, we should understand that community violence is not evenly distributed. It concentrates in specific places among certain people and around particular behaviors. It follows that strategies that focus on these concentrations or clusters are more efficient and more effective than those that don't. And for community violence, homicide, I believe, is overwhelmingly the most important indicator, and that monitoring and evaluation strategies need to be as focused and strategic as possible. If I was going to sort of contrast my presentation with Aubrey's is sort of about going broad. This is about, in one particular area, going deep. So, about No Violence. No Violence is a time-bound initiative, meaning that we were established and we will achieve our goals, and then we will cease to exist. It's aimed at leveraging existing information on violence during childhood to improve policies, practices, and programs. So we're not generating new research, we're synthesizing current research. As a means, and obviously what we're trying to do by doing this is to stimulate global systems and policy change. And we were brought into being by a network of people, researchers, practitioners, investors, advocates, and policymakers. No Violence has three central premises. Number one, violence is preventable. Violence is not the inevitable consequence of root causes or structural factors. Violence can be interrupted and prevented. Sound evidence and effective communication are essential to doing this. to help focus attention globally, regionally, and nationally, and that countries, regions, cities can all learn from one another, and that transferring knowledge across boundaries is useful and indeed probably essential. The way we do this is we hope to address fragmentation, synthesizing evidence across fragmented and siloed disciplines, sectors, and borders. So, we need to make sure the sociologists and the economists are talking together. We need to make sure public safety and public health are talking to one another, and we need to make sure that the translation efforts, north, south, east, west, south, north, west to east, are all working, respectful, and engaging. We need to engage with diversity, bringing regional voices and champions together, making sure that we have a variety of perspectives, and that, I think, importantly includes reviewing literature in languages other than English, and really making an effort to understand different contexts. And then, having engaged with diversity, then trying to integrate all that information into a single or maybe a small number of understandings. Moving towards a broader framework that integrates both human development and child rights. So what do we, more concretely, what are we doing? We're reviewing and reframing evidence to reposition issues of violence in childhood, especially seeking to engage new audiences. We're building conversations across boundaries, and we're publishing outputs which we hope to disseminate widely. Progress to date are 3 learning groups, one focused on violence in the home, one focused on violence in schools, and the final one focused on violence in the community, have all been established, they've all been meeting, and they're all in the process of drafting papers. Our regional roundtables are in process, and half of them have been done. And I believe that we're on schedule to publish our flagship report on or about November 2016. So that's a little bit about no violence. And now I want to transition to talk about community violence and to talk about sort of the state of the evidence and what the evidence is telling us. The first point is something that I came upon in my research, which was that there really has been no comprehensive examination of community violence. Youth violence is closely related to community violence. That really spans the full policy spectrum. And what I mean by that is prevention, intervention, enforcement, reentry, all sectors, all actors, all agencies. And additionally, there's been no meta-review that balances quantitative and qualitative approaches. Generally, you see descriptive efforts with fieldwork, or you see sort of efforts, strictly within the academy reviewing the research. Thanks to USAID, CARSI, Jeremy Biddle is here today. USAID asked us to sort of fill that gap. Myself and Chris Winship, who's the former chair of the sociology department at Harvard University, and I, with a team of research assistants, conducted a systematic meta-review and a field study. So there were 2 components: the systematic meta-review and the field study. For the meta-review, we synthesized the results of over 1,400 individual studies, reviewing the review of reviews. And you can see from the graphic on the bottom that we didn't review individual studies, we actually reviewed the reviews of studies. And the key was focusing on high-quality evidence. What does that mean? Well, at the study level, it meant causal evidence, evidence that's talking about a before, after, or if-then effect. Generally speaking, that means if you've got a research design, it needs to have a comparator. Purely descriptive research or was not included. And then we also wanted to make sure the reviews were of high quality. And the AmStar is a widely accepted tool for rating the quality of a systematic review. we only included in our review studies that had a 6 or higher. Basically, our goal was to replicate the Campbell collaboration methodology, which is really the gold standard in this area, as closely as we possibly could. And if you want, I have many more slides on the methodology that we could go into, but in short, we tried to be as rigorous as possible. In terms of the field study, we did over 20 site visits in the United States and in the Northern Triangle, which is El Salvador, Honduras, and Guatemala. Over 50 semi-structured field interviews. And our goal was, when we were in the Northern Triangle, our goal was to meet with a diverse range of stakeholders inside and outside government to really understand the local context and the local capacity for evidence-informed solutions. Essentially, we anticipated that funders who wanted to work in this area would be the consumers of the report, so we wanted to make recommendations that made sense in that context. And then in terms of the site visits in the United States, in order to make good recommendations as to implementation, we really needed to get under the hood and say, okay, what are these evidence-informed interventions? How do they really work? So how does becoming a man in Chicago really work? We looked at it. How does focused deterrence in Chattanooga really work? We looked at those things. How does violence interruption, the ceasefire method, the LA method, the Peace Institute method, how do these work? So we met with the leaders, the managers, and the staff of all of those, trying to get under the hood. So our definition of violence was adopted from the WHO definition, but you should note probably that it was stripped down. So this doesn't include the sort of broader measures of positive peace. We're only talking about physical violence. We're not talking about sort of economic violence or social injustice or those things. This is really just the dictionary definition. And you'll notice that self-directed violence, suicide, is not included here. And now we wanted to talk about community violence, but to do that, we needed to place community violence in context. And in order to do that, we actually needed to sort of reimagine the broad spectrum of violence. Most of the sort of typologies of violence that are out there are sort of talk about violence in terms of discrete categories. The WHO's typology, the UN's typology, they have very specific categories. If you've done this work on the ground, you just know that that's not the reality. The reality is that all violence is interrelated. It's operating on top of each other at the same time, often with the same people. And so what we tried to do is create a more realistic and resilient typology. And so instead of talking about discrete categories, we really talked about violence along a continuum. I just want to point out this is an imperfect effort. It's improving. I've presented on this before. I often get comments and then incorporate them, and will continue to do so. The basic idea is that we think about violence related to 6 qualities: the lethality of the violence, where it occurs, how many people are involved, whether it's spontaneous or planned, what's motivating the violence, and how frequent it occurs. And what we find is that those qualities generally, but not rigidly, coalesce into certain groups. So for instance, violence in the home, domestic violence, is generally not lethal. It occurs in private. It involves a small number of people. It's spontaneous, and then it's based on emotion. It's expressive of anger or emotion, and it's sadly quite common. On the other hand, formally declared wars between states are intensely lethal. They occur in public. They involve many people. They're highly planned. They're instrumental in nature. They're not based on emotion. They're based on achieving political, economic, commercial objectives. And in terms of per incident, they're infrequent. And one of the sort of most interesting things about community violence is that it is somewhere in the middle. And depending on where you are on this continuum, you have different strategies and you have different partners. And community violence is interesting in that it may have the broadest range of partners necessary. So, for instance, to attack school violence, you might argue that you need no law enforcement presence or at most a minimal law enforcement presence to address the issue of school violence. However, as you move to the right of this continuum, traditional actors like the criminal justice system, law enforcement, intelligence, and then ultimately the military, as you go to the far right, are going to be more important. In many ways, community violence draws upon a very broad coalition. The other thing is that in terms of homicides, I would argue that community violence accounts for more homicides than any other component of violence. It's certainly true for home and school violence, gang violence, organized violence, and probably state violence. State violence is overall sort of maybe accounts for maybe 1/5 of all homicides, and community violence is the largest single component of all non-conflict violence. Okay, I'm going to have to move very fast here. Community violence concentrates globally. We were just talking about that with Aubrey, but it also concentrates locally, and this is a fundamental finding of our study. Violence is highly concentrated around people, places, and behaviors. And one of the fundamental recommendations is that we orient our community violence strategies around people, places, and behaviors. In the evidence here in the United States is overwhelming. The evidence around the world in this area is strongly suggestive. In Boston, 70% of shootings occur in 5% of city blocks. That's been replicated in Minneapolis. It's been replicated many times across the U.S. In 5 Latin American cities, 50% of homicides occur in only 1.6 of all blocks. In most cities, 0.5% of your population is causing 75% of your homicides. Even when you look at a notoriously violent gang, generally speaking, that gang is made up of it is not monolithic. There are associates, wannabes, lookouts, low-level people. But then there are soldiers, sicarios, assassins, shot callers. And there's a small number of people, even within a gang, who are disproportionately responsible for community violence. And then, of course, there are key behaviors that are associated with violence. Carrying guns, belonging to violent groups, either formal or informal, and excessively consuming alcohol. You'll notice that we characterize guns and alcohol and drugs and these other gangs not as things unto themselves, but as behaviors. The reason we do that is for policymakers who are seeking practical solutions. What we want to emphasize is these behaviors are problems, but they need to be aligned in your problem places with your problem people. So this is the way we integrate all of these. Not surprisingly, our review found that the most effective interventions are those that focus on the highest risk people, places, and behaviors. This was true across the policy spectrum. In the public health framework, it's important to recognize that the research is showing that tertiary and secondary prevention are generally more effective than primary prevention. I think that's some evidence that we really have to look hard at. It's not an argument against prevention, but it is an argument in favor of more targeted prevention. So I welcome a discussion about that later. In addition to focusing, we need to concentrate our efforts. The fact is that most of the programs that we studied had only modest or moderate effects. There were a few standouts and a few programs that clearly did not work at all. And so what this means is that success in a highly violent environment probably lies in the accumulation of programmatic effects. rather than sort of a silver bullet solution, which I think we all sort of know intuitively, but I think this is the first time that we can sort of make an evidence-based argument for that. It's not enough to co-locate programmatic effects. Those programs have to be aligned and coordinated with one another. And this gets back to the comprehensive conundrum, which I mentioned yesterday in the community violence subgroup, which is that the evidence is mixed about comprehensive efforts. Comprehensive efforts that are defined extremely broadly, that say, get the schools, hospitals, police, politicians, community members, all together in one place, generally are not effective because they fail under their own weight. They can't be implemented, they can't be sustained, they don't have the political capital necessary to go on. However, smaller partnerships, balancing service providers, law enforcement, others, only the ones who are most necessary to look at those problem places and problem people and problem behaviors, those are the quote-unquote comprehensive efforts that are effective. So that's just a constant. Now, focusing your efforts in these highly concentrated places would never work if crime just moves around the corner. The sort of so-called balloon effect of crime. The evidence here is extremely reassuring. 30 years of research says that the displacement effects of focusing on crime in hotspots are minimal, and actually surrounding areas are more likely to benefit. Note that this is not true of highly organized crime, which we probably all know. So now I'm just going to need like two or three more minutes. I'm going to fly through this. I promise.
I have a 2-minute sign here that I made. It's very official.
I gotcha. So now, in terms of if knowing what we know about the evidence, what does that tell us about measurement, monitoring, and evaluation? The first thing is we need to measure what matters most. I can tell you as a former manager myself, having indicator soup means you don't really measure anything. You've got to sort of boil it down. And I would suggest that we need to focus on 16.1.1, homicide. Why should we focus on homicide? It's widely accepted as the most serious form of violence. It's most costly, it's most easily measured, it's most comparable, it's a leading indicator for other forms of violence, and it's deeply regressive. Meaning, if we focus on violence, we will necessarily be working with the poorest of a given society. Something to think about. Monitoring. Following this, we need to build and improve reporting systems for homicide first. There are at least 3 forms of reporting: law enforcement, public health, and victimization. In order for that to be effective, the data must go down to the address level. It has to be granular. Otherwise, you don't get the benefits of efficiency. And then we should study, publicize the cost of violence, as Aubrey is doing, and we need to monitor the response of institutions as well. How many police are there? How many hospitals are working on this? How many emergency rooms? Do we actually have the prevention providers in the most important areas? Note that I say not schools. The reason I say that is because for community violence, those small number of people and places that are generating the community violence are not in school. Those people are generally not in school, so we need to keep that in mind. And then with evaluation, we need to begin with evidence-informed approaches, and we need to build local capacity for monitoring and evaluation. This is my key point on evaluation. It has to be more strategic. We have to focus on the cumulative building of knowledge and comparable knowledge, as Aubrey is doing. We have to focus on the most important strategies and outcomes, focus on replication, not novelty, and use consistent methodologies across contexts. My suggestion is that we do systematic reviews, but we plan for those systematic reviews. The World Bank, USAID, IDB, other funders should all be insisting ahead of time that if you're going to do research and evaluation for us, you use consistent outcomes, you use consistent methodologies, so that the results of your research can all talk to one another. And who can insist on this? Funders can. So in conclusion, those are the things, and thank you very much. And thank you for your patience.